Hello, everyone. Good afternoon, and welcome to our AFTD advocacy webinar, Paving the Path Forward, Advancing AFTD's Public Policy Priorities. I'm Megan Busby, AFTD's Director of Advocacy and Volunteer Engagement. And on behalf of AFTD and our guest presenters today, I'd like to thank you all for joining us today. This webinar, we hope, gives you a better sense of AFTD's policy positions and how we will work to achieve them in the current political climate. But before we get started, there are a couple things that I'd like to point out. If at any time you find yourself having technical difficulties as you watch this webinar, please use the Q&A function at the bottom of your screen to explain your problem. We do have an AFTD staff member that's working behind the scenes that will be able to help address your issue. Following the presentations from our speakers, we will open the floor to questions from the audience. To submit a question, again, please simply use the Q&A function that's located at the bottom of your screen. And you can send your question in at any point throughout this webinar. You do not have to wait until the Q&A portion. We will try to get to as many as we can, and if we're unable to answer them live, we will follow up. Finally, this webinar is being recorded and will be archived on AFTD's YouTube page for later viewing. Next slide, please. AFTD's annual education conference is coming up very quickly. It's taking place this May at the Omni Interlaken Hotel near Denver, Colorado. Please join us in person or online via a free live stream. And the full conference will be held on May 2nd, but those attending in person can also sign up for a half-day symposium devoted to genetic FTD, which is new for 2025. The Genetic FTD Symposium will be held on Thursday, May 1st. To learn more, please visit the URL at the bottom of the screen. You can also register to receive an email as soon as conference registration opens up next month. Later in this webinar, we will bring out our guest speakers who join us from Innovation Policy Solutions, which is a government affairs firm located in DC that AFTD has newly partnered with to help us advance our policy priorities and our policy agenda that was approved by the AFTD board at the end of last year. But before we get started and dive a little bit deeper into our policy priorities, I want to ask you all a question. We can launch that first poll. So just curious, out of curiosity, who joining us today is already signed up to be an advocate via our Action Center? We'll give folks just a little bit of time to see where everybody is and all right. Well, it looks like there are some of you signed up. 28% of you are already currently signed up, but 72% of you, a large majority, are not. So we really appreciate you being here to learn more, and we hope that you will sign up, and we will be sharing later on how you can do so. Thank you for participating in our poll. So happy to get started then and diving a little bit deeper into our new policy priorities. I do want to take this opportunity first to thank everyone and anyone who's on the call that participated in our survey back in August, where we asked folks from the community to help us vote and prioritize on the issue areas that we should be focused on related to policy. So thank you very much. It was really helpful to hear from everyone on what we should really be focusing on as we enter this sort of new phase for us here at AFTD. This is our first policy agenda. And I mentioned that our board, the AFTD board, did vote and approve on this agenda in December, so last December. And also, as it is our first one, we will be, of course, this is kind of a starting point for us. We will be using it over this next year. It is an annual policy agenda that we will be revisiting every year and tweaking in areas that we think make sense strategically as we move forward. And so we'll continue. This will be somewhat of a learning year for all of us. We want you to join us in these efforts, but we're excited to get started and really create a footprint in DC specifically, which we've not had before. So A quick sort of overview of the policy priorities, as you can see laid out before you. These are also now publicly available on our website. So encourage you to look at our advocacy portion of the website to, I can't get to everything today on the webinar, they will be on the website, and we are currently working on fleshing out all of the web pages around supportive educational materials and information on each of these different issue areas. So at the federal level, you can see there are 4 areas of focus. You might hear us refer to them as buckets. And they are around, the first one is devoted and concerning FTD research and drug development. The second one is around expanding access to quality dementia care and support services. Our third area of focus is related to FTD family caregivers and supporting them. And then the final one is increasing awareness in general of FTD among federal legislators. Our state policy priorities, we will also continue to increase awareness of FTD with all of the state legislators across the country through our efforts around securing awareness resolutions and proclamations. And we'll get into that a little bit more. Next slide, please. So our first area of focus is all around promoting innovation in FTD research and drug development. Specifically, we will be advocating for increased or sustained funding for biomedical research to identify and verify FTD diagnostic tools and biomarkers, developing treatments and therapies to treat FTD symptoms, as well as prevent disease progression, as well as, really importantly, obtaining accurate estimates of the prevalence and incidence of FTD, as that is something that we do not currently have a lot of information on. So, you probably have heard, we've spoken a lot around the fact that we believe that FTD is underdiagnosed, certainly misdiagnosed, and that the incidence rate could be much greater than the numbers that we tend to use when speaking publicly about it. So there are 3 pieces of legislation that fall under this promoting innovation in FTD research and drug development. One of those is the National Alzheimer's Project Act, or NAPA. We like to use a lot of DC likes to use a lot of acronyms, as well as the National Plan to Address Alzheimer's Disease. So you will notice Alzheimer's is mentioned in both of these terms, and you do not see FTD spelled out. I can assure you, though, that FTD is included in both NAPA and the National Plan because it is inclusive of related dementias, of which FTD is one. This is a piece of legislation that was reauthorized last Congress, so we won't be advocating for the passage of this bill in this Congress, but we will be monitoring any sort of implementation around the strategies within and ensuring that FTD has a voice at the table. Similarly, the Alzheimer's Accountability and Investment Act establishes a bypass budget as part of the National Alzheimer's Project Act, and that also passed last Congress. So thank you to everyone who took part in our what we call action alerts or action campaigns that we emailed you all and asked you to email your legislators about the importance of passing both of these pieces of legislation. Your involvement and raising your voice worked, and happy to say that both of these did pass last Congress. The Healthy Brains Act is a piece of legislation or bill that was introduced last Congress that did not pass. So this is something that has been listed on our policy agenda or as one of our policy priorities, but we are awaiting reintroduction in this Congress. So the Healthy Brains Act stands for Harmonizing Environmental Analyses and Launching Therapeutic Hubs to Yield Bolstered Research and Innovation in Neurological Science. I know that is a mouthful, but it was bipartisan legislation that would essentially create a center at the NIH to conduct research on environmental and occupational risk factors for neurodegenerative disorders as a whole, of which FTD is also included. Next slide, please. So our next area of focus is all about access to quality dementia care and support services. So we will specifically within that, be advocating for consideration of FTD disorders in policy and emerging models of dementia care, which does, of course, include the collection and evaluation of data at the dementia subtype level, and by age, so that equitable access and specific care needs of people with FTD or other non-Alzheimer's dementia can be understood. The four bills and or areas underneath this second area of focus are the Medicare 2-year wait. So really advocating, this is a very aspirational goal of ours that I foresee being on our future policy agendas as well, because it does involve a lot of work to make it happen, but advocating to eliminate the 2-year waiting period for Medicare coverage for individuals who qualify for full and permanent Social Security disability benefits due to any FTD disorder. The Bold Infrastructure for Alzheimer's Reauthorization Act. Unfortunately, this bill did not pass last Congress. We are again awaiting its reintroduction this year. This involves endorsing what BOLD stands for is Building Our Largest Dementia Infrastructure for Alzheimer's Act. Again, Alzheimer's being specifically called out there, but inclusive of FTD, to continue to strengthen the public health infrastructure and implement effective dementia interventions focused on increasing early detection and diagnosis, reducing risk, and preventing avoidable hospitalizations. This is a program that authorizes the CDC to implement different programs around dementia care and services. The guide model, the Centers for Medicare and Medicaid Services, CMS, guide model. I don't know how much the community that's listening is aware of the guide model. AFTD has been working quite hard and diligently in creating partnerships and talking to people across many different areas to understand and learn more about the guide model that has been rolled out. It is an 8-year rollout in which we will be learning a lot more, and so advocating within the guide model, advocating with CMS, advocating to CMS to make sure that FTD is included, and ensuring that people under 65 and those with non-amnestic presentations of dementia are included in these models, and basically that the needs of people with FTD are addressed across the trajectory of disease progression, including end-of-life care. We have more information that will be forthcoming on this. There will be a session at the upcoming education conference related to the guide model. So encourage everyone to register either virtually or in person to hear more about that. But we will also have more information coming out and education on that. And finally, long-term care access and appropriate care. Understanding this is a huge issue for families that are impacted by FTD. So really advocating and supporting greater affordability and accessibility of FTD capable long-term care services and supports, including respite care, in-home care, nursing and home health, adult day care, short-term care, and long-term residential care. Next slide. So supporting family caregivers, increasing financial support for family caregivers, including any caregiving tax relief programs or paid leave policies that are being considered. We are in strong support of this. There was an AFTD study that showed the huge economic burden of FTD, around 120,000 each year, and that 37% of FTD caregivers had to stop working post-diagnosis. So we understand and hear that this is a very big issue for our community, and something that we are working in partnership with other organizations on. So you'll see the national strategy to support family care That is in partnership with the National Alliance for Caregiving, and it's all about supporting the national strategy that's in place to support family caregivers and the RAISE Family Caregivers Act from 2017, which stands for Recognize, Assist, Include, Support, and Engage. And we continue to work in partnership with them on however we can advocate for different bills and policies that are put into place that come out of the national strategy. The Credit for Caring Act is a bill that was introduced again last Congress. You can sense a theme. We are in a transitional period. The new Congress has only been in place for about a week. So we believe that there will be these bills will be introduced in the future months, and that we will be able to mobilize everyone and ask you all to join the efforts in advocating to your federal legislators and asking support of these bills. This was bipartisan legislation that would provide a non-refundable federal tax credit of up to $5,000 for eligible working family caregivers that would cover 30% of qualified expenses incurred above $2,000. The aim is to alleviate financial burdens on caregivers who often reduce their own health care or dip into savings to provide care. It does cover expenses such as home care aides, adult daycare, and assistive technology. And so it was introduced, as I said, as a bipartisan bill last Congress. And we, again, as I said, are waiting for it to be reintroduced. And finally, the Older Americans Act is another bill that was in Congress, last Congress, that again, we're waiting for it, and we'll be advocating for the reintroduction of this bill so that we can continue to push for and support greater inclusion of and resources for families and individuals living with FTD in aging services and programs that are specifically funded by the Older Americans Act, regardless of the person's age. Next slide. And finally, around increasing awareness of FTD among federal and state legislators. For the last year now, approximately a year, we have had a call to action for folks like yourself to go to either your governor's office if you're seeking an awareness proclamation in your state, or to your state legislators and ask them to sponsor an Awareness Week resolution. Last year, or this, I guess 2024, yeah, so last year, we were able to secure 4 awareness resolutions in 4 states, and then 21 city, state, or town proclamations across the U.S. We have a lofty goal of achieving that in all 50 states and would love your help and support in securing those. We do have toolkits on our website that Matt will showcase later in the webinar. And they're really pretty clear of walking you through exactly how to do this. But if you have any questions ever, please email advocacy@theaftd.org. We are more than happy to help you and support you. We would also like to see a FTD Awareness Week resolution at the federal level. That is not something that we achieved last year, and something that we would like to work with federal legislators on securing for this year and beyond. Additionally, around our state policy priorities, we've been very grateful that Senator Michelle Hinchey out of New York has been a huge champion of AFTD and FTD issues, and last year introduced a registry bill in New York and has reintroduced it this year, and it is moving. It is moving through the Senate. It passed the Health Committee. It's in the Finance Committee currently, or maybe it's past the Finance Committee. It's moving very quickly in the Senate, and we are also working on getting it reintroduced on the Assembly side. So there is a lot of movement. If anyone on this call is from New York, we'd love to hear from you, work with you, see how we can support you in asking for support of this bill in New York from your own personal legislators. And then finally, California is another state that we've already been working within, that we like to continue to focus on, given its population and how big and large it is, and how New York and California can be very influential around federal legislation. So we are currently working on the Alzheimer's disease and related dementia committee or council that exists in California, working to get a representative on that council to have FTD at the table as they continue to shape policies in California. And potentially there's a neurodegenerative registry that exists in California, so we will be advocating for inclusion of FTD in that neurodegenerative registry. And next slide, please. So at this time, it is my pleasure to introduce our 3 guest speakers to you all. As I mentioned, they join us from Innovation Policy Solutions, a Washington, D.C.-based government relations firm that has successfully influenced healthcare and medical research policy for the last 2 decades. First, we are joined by Jennifer Lieb, who founded Innovation Policy Solutions, which is a firm that specializes in genomics and precision medicine policy. Board certified in genetic counseling, she also worked at the National Institutes of Health, the Senate Committee on Health, Education, Labor, and Pensions, and in the biotechnology industry. Next, we're joined by Megan Anderson Brooks, the president of Innovation Policy Solutions, where she lobbies and consults on a broad range of health and science policy issues. As a researcher in the field of neuroscience for over 10 years, Megan brings firsthand experience and a scientific understanding to her work. And last but not least, we're joined by Lindsay Trischler, who is a principal at Innovation Policy Solutions, where she shares her expertise on the appropriations process, coalition management, insurance benefit design, and access to affordable care. She has worked with a variety of organizations, including patient advocacy, professional medical societies, and public health. Welcome, ladies. I'm glad to have you here.
Thank you. And I want to first thank everyone for joining the webinar. It's great to see so much interest in policy. I believe there's over 100 people listening in, which is terrific. I just wanted to quickly say thank you to the association for the opportunity to assist them with their federal advocacy work. We very much look forward to a productive year together and hopefully to achieve AFTD's goals here in Washington. And in that regard, we also hope to have the opportunity to interact directly with you, either through the Action Center or through the AFTD staff. So thank you again for your interest in policy. And with that, I'm going to pass the presentation to my colleague, Lindsay, to tell you all about what to expect with the new Congress and the new administration.
Thanks, Jen. And hello, everyone. To echo Jen, I'm really excited to be working with all of you. And over the next few slides, I'm going to provide an overview of what we can expect in the next couple of years. So we can go to the next slide. Before we get into some of the details, I want to provide a brief Government 101 refresher. So you probably all know that the federal government is made up of 3 branches: the legislative, the executive, and the judicial. Each has their own unique powers and responsibilities that help to maintain our system of checks and balances. The executive branch includes the president and his cabinet members who head up the different federal agencies and departments. The judicial branch includes the federal court system, which is not only the Supreme Court, but also the district courts and the circuit courts. And the legislative branch consists of the Senate, which is referred to as the upper chamber, and the House, known as the lower chamber. Go to the next slide. So next, we're going to take a little bit of a closer look at the legislative branch. There are some key differences between the 2 chambers in terms of both their makeup and their exclusive powers. The House has a 435 voting members and 6 non-voting delegates that represent DC as well as the US territories. The number of members from each state depends on population, which is determined every 10 years by the census. Congressional districts are then drawn up by state legislatures and on average have about 761,000 people in each district. And representatives serve 2-year terms, and in terms of exclusive powers, the House has the power to initiate revenue or taxation bills. They can also impeach elected officials and elect the president in the case that there's no majority in the Electoral College. In the Senate, there's 100 voting members, 2 from each state, and they serve 6-year terms, which are staggered. So every 2 years, about a third of the Senate is up for re-election. The Senate has more significant exclusive powers than the House, which include consenting to treaties, confirming cabinet secretaries, and other executive officials, and they also confirm military officers and judges. And on top of that, the Senate is responsible for the trial of officials that are impeached by the House. Next slide. So this is a look at the party divisions in the 119th Congress. In the Senate, Republicans have a 53-seat majority. You'll see that there's 2 circles that are not filled in. Those are for Republicans. John Husted and Ashley Moody were sworn in just last week to fill the seats that are left by Vice President J.D. Vance and Secretary of State Marco Rubio. So the remaining 2 seats in the infographic, like I said, will now be red. It should also say that there are 2 independent members caucusing with the Democrats, which are Bernie Sanders of Vermont and Angus King of Maine. Last Congress, there were 4 because Kyrsten Sinema of Arizona and Joe Manchin of West Virginia were also independents caucusing with Democrats, but they did not run for re-election this year. And then moving on to the House, you can see there's a very slim Republican majority. You would need 218 votes to win a majority vote. And right now, Republicans have 219. The vacant seat is for the 1st District in Florida, which was occupied by Matt Gaetz, who has since resigned. It's expected that a Republican will win that seat in a special election, so that would bring their number to 220. You can go to the next slide. And before we take a closer look at what to expect out of the next Congress, it's important to note that when comparing it to other Congresses, the last Congress, the 118th, was very unproductive. There were only 224 laws enacted, which, as you can see by the graph, is the least amount in the last 25 years. We expect the issue of partisanship to continue, but since Republicans are in control of the House, the Senate, and the White House, there's likely more synergy when it comes to policy priorities, so it may be more productive. We expect that a lot of the priorities will center around the administration's Make America Healthy Again initiative. And before we give an overview of some of those topics that we expect to be prevalent, we want to give some more information on 3 of the bills that Megan talked about that had died at the end of the last Congress and need to be reintroduced this Congress. Next slide. So the first is the Healthy Brains Act. The long acronym that Megan talked about is over on the side. There's one thing Congress loves. It's like a fun acronym for their bill titles. So this legislation, Megan talked a little bit about what it does, but it was introduced in the House by Jennifer Wexton and Gus Bilirakis. Congresswoman Wexton recently retired because of her PSP diagnosis. So there's going to be an effort to identify another Democrat to take her place as a lead sponsor of the bill, along with Gus Bilirakis, who is a Republican. Despite the partisanship that does exist in Congress, a lot of legislation that's related to biomedical research does have bipartisan support. Next slide. The next bill is the Credit for Caregiving Act, which again, Megan touched on a little bit. In the last Congress, it was introduced in the House and the Senate. In the House, there were 81 co-sponsors, and the Senate had 17. There's many stakeholders that are supportive of this legislation, and earlier this month, the AFTD, along with about 100 other organizations, signed on to a letter urging Congress to include the Credit for the Caregiving Act in any upcoming tax legislation. And another notable thing is that President Trump indicated during his campaign that he was open to the idea of tax credit for caregivers. He did not really give any details on specifics of what that policy may look like, but it does indicate that he may support legislation if it was passed. And then the next slide. The last bill we want to highlight is the Older Americans Act reauthorization. It was first passed in 1965 and needs to be reauthorized or passed again every 10 years. The current authorization expired on September 30th, and the reauthorization was initially included in an end-of-the-year healthcare focus package. Unfortunately, Congress was not able to pass that package before the end of the year, but the inclusion of the OAA demonstrates that there is broad support for the legislation, and we expect its reauthorization will be a priority early in this new Congress. It is important to note, though, that this legislation reauthorizes the programs. Congress would still have to pass separate legislation to allocate the funding for the programs themselves. Next slide. So now we're going to zoom out a little bit. There's a number of policy areas Congress and the Trump administration are expected to prioritize. And as you can see from this list, there's a wide range of health policies that we expect to be a focus. And many of them, like telehealth, improving access to healthcare in rural areas, and oversight on Medicare Advantage plans, all have a lot of bipartisan support. And then again, as I mentioned, we expect there to be a focus on chronic diseases, food safety, and environmental health factors as a part of the Trump administration's Make America Healthy Again initiative. Next slide. And then before diving deeper into what we might expect from the Trump administration, I want to provide some background on how the regulatory process generally works. So Congress gives rulemaking or regulatory authority to federal agencies through legislation, and then using this authority, agencies then can develop draft regulations or proposed rules. Once the proposed rule is drafted, OIRA, or the Office of Information and Regulatory Affairs, reviews it, and the draft rule is then published and open for public comment, which gives interested individuals and organizations like the AFTD the opportunity to share their perspectives on the draft and request changes. Once the comment period is over, the agency reviews the comments and makes changes. The final rule goes through another round of review at OIRA before being finalized and published. During President Trump's first term, he did not publish a lot of rules when compared to other administrations. And we do expect that this trend will continue in his second term, along with efforts to deregulate and reduce regulatory burdens. Next slide. The individuals who oversee the various health agencies and departments also play a big role in shaping and implementing an administration's policy agenda. So the Senate has the power to confirm nominees, and the graphic on the left illustrates that process. It's not dissimilar to how a bill becomes a law and that the process that legislation goes through, but during President Trump's last term, it took until April for just the cabinet level positions to be confirmed. And for all of his nominees, it took an average of 54 days from the announcement of their nomination to their confirmation. Several of the nominees that will play an important role in the healthcare agenda have been announced. So we can go to the next slide. The first is Robert Kennedy Jr., who is nominated to serve as the Secretary of Health and Human Services. His confirmation hearings will actually be taking place tomorrow and Thursday. And he's expected to focus on re-examining the FDA safety and efficacy standards, as well as take a closer look at prevention and management of chronic disease, food regulation, and other public health initiatives. Next slide. Jim O'Neill is nominated to be the HHS Deputy Secretary. He has experience in government as he served as a Principal Deputy Secretary for HHS during the George W. Bush administration. He also was the CEO of SENS Research, which focuses on regenerative medicine solutions for age-related diseases. And one of the priorities he's had in the past has been advocating that medicines should be approved by the FDA based on their safety rather than also requiring effectiveness data. Next slide. Martin McCary is nominated to serve as the FDA commissioner. He is a surgical oncologist and has done a lot of his research in the underlying cause of disease, vulnerable populations, and the appropriateness of care. He has been vocal in advocating for lowering the cost of treatments and the need to reduce unnecessary procedures and medical errors. Next slide. Dr. Oz, who many of you may recognize, is nominated to head CMS, or the Centers for Medicare and Medicaid Services. He is a cardiothoracic surgeon and former Pennsylvania Senate candidate. He has been very vocal in his support of Medicare Advantage plans, which is expected to continue. In this role, he'll also be responsible for the drug price negotiations that were established by the Inflation Reduction Act that was passed at the beginning of the Biden administration. Next. Dave Weldon has been nominated to head up the CDC. He's a former congressman and a board certified internist. And during his time in Congress, he was a big advocate for medical privacy rights. And then next slide. Finally, Jay Bhattacharya was nominated to be the next NIH director. He is a physician and currently a professor of health policy at Stanford University, where he directs the Center for Demography and Economics of Health and Aging. His research has focused on the role of government programs, biomedical innovation, and economics. Next slide. So to wrap up, we expect that there will be a lot more synergy among Congress and the administration in terms of health priorities, but the narrow majorities do mean it might be difficult to pass legislation that could be viewed as controversial. We also expect that there will be changes to federal agencies and their priorities and organization, as well as an increased emphasis on reducing regulatory burdens. With that, I'm going to turn it over to Matt Sharp, who is going to give an overview of the advocacy platform, but my colleagues and I will be back during the Q&A to answer any questions you may have.
So thank you, Lindsay, Megan, and Jennifer, for that amazing overview and all your insight. Like Lindsay said, the team from Innovation Policy will return in a few minutes for Q&A. But first, I'd like to introduce myself. I'm Matt Sharp, AFTD's Advocacy Manager, and I'm going to walk everyone through AFTD's updated Advocacy Action Center. For many of you watching who aren't already signed up, this will be a good introduction to it, because our Action Center will be the quickest and easiest way for you to take action and help move AFTD's policy priorities. But before I get into it, I have another quick question for our audience. So we'd just like to know, how have you reached out to your federal legislators in the past? Just give us a sense of how active and what kind of experiences you've had doing this before. So it looks like emails definitely leading the way, is kind of expected. That's really how a lot of this is done nowadays, especially. But it's good to see that some folks have made in-person visits too, because that can be one of the most impactful ways to do this. Well, thank you all for responding, and hopefully we'll be able to give you guys all some more opportunities in the future to do even more of this. So it's good to see that folks do have some experience already. All right, so getting into it, let's open up quorum. And so first, like I said, first step for all this will be to sign up, and you will be able to get the most out of this by just signing up with your name, email, phone number, and address. So, and after you're signed up, Quorum will be able to tailor the information that's available to you. For example, you'll be able to look up your federal, state, and local officials by going to your My Officials tab. So here we have Omer is already signed up. So these are his officials. And if you click on the name of somebody, you'll be able to find contact information, including phone numbers for their office, as well as all their social media. But you'll also be able to log interactions or relationships you have with individual legislators. So please feel free to enter any details about interactions or relationships you're willing to share with AFTD by clicking on, the relevant red button on the screen that you see there. And so in addition to links to both AFTD's main website, but also our policy priorities, you can follow the progress our advocates are going to be making across the country in securing Awareness Week resolutions and proclamations through the Proclamations and Resolutions tab. As you can see on the map, there's already efforts underway to secure either a resolution or a proclamation in 15 states. So things are definitely already started, even though our Awareness Week isn't until September. And so most states will want to try and time things, but you can definitely get started doing this today. And you'll also be able to download both the resolution toolkit or the proclamation toolkit directly from the website here, along with some other information. And you'll have it gives you our email address, so you can reach out to us and let us know what you want to do and how we can help you. And then finally, the main item here is the Take Action tab. And this is where all of AFTD's legislative and policy campaigns will be accessible. Like we said, we don't have any current active campaigns at the moment, but this is where you're going to find opportunities to contact your legislators about bills and issues relevant to AFTD's policy priorities. If you have signed up in quorum or taken action in the past alerts, we will be reaching out to you as bills are introduced throughout the new session and providing information about what the bills are and how you can take action, either writing emails or possibly even making phone calls. So and with that, I'll just make one more plea to, if you have not already done so, please do sign up with us. It's really going to be how we're going to be able to join this effort to move our policies forward. And it's going to be how we are going to be able to keep you most up to date and informed about what's going on. So now, before we get to our Q&A, we have one final poll. So have you learned anything new about AFTD's public policy priorities today? And I'm glad to see that. Seems like a resounding, almost resounding yes. So thank you so much. And with that, I will invite our guests back onto the stage.
Thank you, Matt. We are once again joined by the team from Innovation Policy Solutions. We're going to take questions now. We have received a few questions throughout the presentation, but encourage folks to please type in your questions via the Q&A while we are live here. I'm going to ask some of these live so that both iPolicy or Innovation Policy Solutions, as well as myself as the representative of AFTD, can help answer them. So there's actually 2 questions in here related to the federal funding freeze that is going into effect at 5 p.m. today. And one question is, are we concerned about that? The other question is around, are we going to share any ideas for how we can reach out to protest those recent efforts? I'm going to allow iPolicy to answer first if there's anything that an individual advocate can do, and then I'm happy to answer just what we are doing as an organization.
Yeah, thanks, Megan. I think across the board, all healthcare advocates are very concerned about the announcement from the administration yesterday about the pause in all federal funding. It's not just for research, but it's also for other support services that organizations provide for individuals throughout the country. First, just to let you know, there are lawsuits that have been filed to challenge it. So there might actually be an injunction, which means it will stop the policy from taking effect. So there is a chance this policy does not go into effect today, which would be great. But setting that aside, absolutely, you can always engage in the discussion. And the simplest way to do that is to contact your member of Congress. You can go to house.gov or senate.gov. You can look up your representative or senator based on your zip code or address or what state you live in, and then it will take you to their website. And from there, you can look in different ways in which you can contact that office by phone or email.
Thank you, Jen. And from the AFTD standpoint right now, as Jen's already stated, we're closely monitoring this situation and really assessing and strategizing for the best response as we learn more information moving forward. And we will certainly be sure to circle back to our community and let you know if there is anything that we're doing, and then asking you all to do on behalf of AFTD. I'm sorry, a lot of questions are coming in, so I just need to kind of go through them. It looks like we have one here. Can families be encouraged to advocate for these policy changes? I absolutely think that you should be encouraged to advocate for these changes. I know that a lot of the policy priorities that we went through don't currently have a bill for us to lobby for or advocate for, and ask you all to lobby for them as well, but they will. And I think you can absolutely feel hopeful and encouraged that we are creating a footprint in DC with, federal legislators that have not heard from AFTD or the FTD community in the past. So there's a lot of encouragement and hope to be felt. Let's see, there's one here related to working with the Alzheimer's Association on a local level. I think that's a great question, as well as a great opportunity. We do have volunteers who attend the chapters advocacy days, which are lobby days in your state. We just had a volunteer who's on this call attend in her home state, and had a great positive experience. It's a great opportunity to partner with your local Alzheimer's Association chapter and bring the voice of the FTD community with you. We can also, here on the advocacy team, can provide you with folders of information to take with you during that lobby day that you can present to the member that you're meeting with, or the staff person that you're meeting with, that would help to educate them on, FTD in general and the things that we're also working on. You can sometimes have your own asks in those lobby days. And so again, just reach out to the advocacy at the AFTD.org email address, and we will provide you guidance and support around that. Let's see. If that is helpful. I don't actually understand that question. Let's see. How about, are there additional ways in which researchers, besides their scientific work and as private citizens, can advocate for FTD causes? I'm asking as a principal investigator that's not conducting FTD research, but would like to further advocate from a research background. That's a great question. I don't know, Jen, if you have any responses to that outside of what I would say. So
I think you can respond the same way you would respond as a citizen, as a patient, as a family member, as a researcher. It's the same, whatever aspect of the policy issues that AFTD reviewed earlier in the webinar. If you want to get involved through their action center, sign up to participate in congressional meetings, contact your own member of Congress. I think those are all great ways to participate in any of your capacities, professional and personally.
yes, thank you.
And I will add too, if you're a member of your own scientific society, perhaps you said, that's another way. Most professional societies representing researchers and scientists and physicians, they all also have advocacy programs. So perhaps there's some overlap there for you to advance FTD causes through that as well. Sorry.
Thank you. And sorry, I'm just looking. Someone's asking if we partner with the Alzheimer's Foundation of America. We do not, on the advocacy side, currently partner with the Alzheimer's Foundation of America. We may partner with them on a research side or a care and support side. That's something I would have to talk to my colleagues about. But I will say that we are currently looking at and evaluating different partnerships and coalitions that we can be a part of and form so that our advocacy efforts will be enhanced by working with other groups. So it's a great opportunity for us, again, to form some partnerships at the federal level. Someone else, again, another AARP is a great advocacy group for family caregiving. I couldn't agree more. The Credit for Caring Act is being very supported by AARP. One of our board members here at AFTD works at AARP, so we have a really great relationship with them on an advocacy level. And I see there's some very specific questions in here that I don't feel like we're in a great position to answer to the full group, just specifically about some policies around certain things, like what can be done policy-wise specifically for, fill in the blank, the needs that you're putting in here. But we are happy to work with you and answer those via email. As I stated, I will say, as I stated before, this is our first official policy agenda, AFTD policy agenda. And so we, like I said, it's a starting point for us to learn more about the needs of the community and what impact we can have around policy and how much we can move the needle. And we'll be evaluating or reevaluating continuously and evolving it over time. And each year, really looking to see, what our strategy is going to be moving forward. So, okay, I think, are there any, there's every time I think we've gotten to them, then more come in. Okay, there's prioritized. Okay, there are so many initiatives. Are they prioritized? That's a great question. And we will be prioritizing them by working with our partners here that you have seen and met now at Innovation Policy Solutions. We will be having a strategy session coming up very soon in the next week that will help us develop that prioritization around where we're going to start and how we'll best move forward with, who we're going to target, which of these issue areas we're going to start with, et cetera. And I know someone's asking if we have any programs planned for Rare Disease Week in DC. AFTD is attending some events that are being held around Rare Disease Week, and we will also be promoting it on social media. But I'm happy to talk to you offline around, I see you'll be there representing CureMap PT, FTD, which is amazing. And so if our paths do cross, would love to meet you in person. And yes, this was recorded. I see someone missed the beginning. This was absolutely recorded, and we will be sending it out to everyone. It will also be available on our YouTube channel. Okay. I think, let me just give it, folks, because we still have a few minutes, so I'm going to pause here and see if any more come in. Is there anyone? Okay, that's probably an offline question around partnering with medical schools. I think it's a great suggestion. Happy to talk about that offline and refer you to some of my colleagues who could speak more to that point. And other people are just saying this was great. So that's great. I'm glad this was helpful. Again, I can't emphasize our email address anymore, but I'm going to say it one more time: advocacy@theaftd.org. Also, you know what? There was a question I wanted to answer. I have to go back and find it, I think. Someone had a question about the proclamations and the resolutions. If they're working on it in their state, is there a way besides our map online to showcase if there are other people interested and or, you know, already working on that. Again, not to be a broken record, but it is to email advocacy@theaftd.org. That is Lauren Pelea, our colleague who is behind the scenes right now and helping to answer some of these questions, keeps track of all of that for us, all the activity and who's doing what, and can put you in touch with folks in your state who are also interested in securing awareness resolutions. So again, just can't encourage you more to do that. And I think with that, let's see. Oh, is that our email address that I just keep talking about? It's on there. So now you can see it on the screen live. Also, just another plug, going back to the first poll, with 70% of you not already signed up for our action center. Just again, one final plug to please sign up. That is going to be the best way for you to stay involved and hear from us when, you know, these pieces of legislation do start moving, as well as being educated on the issue areas, everything that we would like to work on and how you can be a part of that is going to be really important. So please just sign up. Thank you so much. If there's no further questions, I'm going to check one more time because we seem to just be a little bit ahead of schedule, but I do not see any more general questions coming in. I know there were some very specific ones and happy to take those offline. So this concludes today's webinar. I want to thank Jennifer, Megan, and Lindsay again for joining us today and for all the work that they've done already in the few short weeks that we've been working with them and that they will continue to do on behalf of the AFTD community. Thank you to my colleague, Matt Sharp, for walking folks through our new Advocacy Action Center. Thank you to our attendees for all the questions that you submitted. As I stated, we didn't get to all of the specific questions, but we will absolutely reach out via email, or if you would like to discuss further, please again, be sure to email our advocacy@theaftd.org email address. And I just want to wish everyone a wonderful evening and thank you again.